Okay, perfect. And hello, everyone, and welcome to this new evening. There has been a change in the speaker because was meant to be Anselmo, that was of my friend's colleague, but obviously there has been yet other commitments, so he wasn't able to join us this evening. So I literally will introduce you and give you a glance of what is the ultrasonography in exotics and why we need that for our patients. Obviously, I'm not an ultrasonographer, so with all the limits of that, but I would like to report to you some of the situation where the ultrasound could be very, very helpful when we, as a vet, can help your animal that are your patients. So I just want to remind you that this is an informal and friendly webinar. So is it recorded, because the recording will be uploaded on the YouTube channel. So if anyone will miss some bits, will be available to be on the YouTube channel. And also there are no stupid questions. So if you have any question, please just on the chat, and at the end of the lecture of the webinar, I will try to answer as much as I can. So, a word in black and white, what an ultrasound can tell us. As I said, this evening will be focused on ultrasounds, but I will speak also a little bit about the other investigation that we can perform when you, with your animal, you're coming to the vet practice. Just a brief introduction of myself for those who don't know me or haven't followed me in the previous webinars. My name is Gianluca, and I'm a vet who deals with exotics and zoo animals. Currently, I am part of the clinical and teaching team at the DICPET rabbit and exotic practice at the University of Edinburgh. And I'm particularly passionate about topics such as welfare and husbandry. And I create this series of webinars to try to bring the world of veterinary medicine to a level that is understandable for everyone. We have already covered topics such as first aid, ear disease, environmental enrichment, how to care about our elderly patient, brumation in tortoise. And as I said, today we are going to the vet practice and see what we can do once you are there. So, obviously, when you're bringing your rabbit, guinea pig, parrot, tortoise, whatever you want, what we usually need after a physical examination, if we want to understand better what is going on, we need some complementary investigation. This complementary investigation can be, for example, blood or urine sample to test blood for kidneys and liver parameters, urine to assess how the kidneys are working, feces if we want to check for parasites, blood in the feces, or anything else that can help us to understand if the gastrointestinal tract of your animal is working well or not. And regarding this, there is another webinar that I've done specifically on this topic that you can find, again, as I said, on the YouTube channel. Then we can collect a sample of skin or fur or feathers, if it's a parrot, to see for skin or external parasites. FNA means the acronym for fine needle aspirate. So whenever there is a lump or mass or something that shouldn't be there, and we want to know what is going on inside, usually what we can do most of the time under sedation is with a needle, literally try to sample the content of this mass to give you an answer, possibly. Performing then a cytology exam, so literally going to see under the microscope which type of cells or fluid or material was inside this lump. Or we can have also the big family of diagnostic imaging. Diagnostic imaging contain few different exams that are specific for what we are going to looking for. Ultrasonography, the specific one for this evening. Then we have radiography with obviously X-rays, CT scan, or MRI. Yes, also in animals and also in exotics, we can perform CT scan and MRI. Sometimes I still find people that are surprised that something that we think that is just for human beings, just for us, can be also used to discover what is going on in the animals. And all these group of complementary investigation can be, most of the time, helpful to arrive to a diagnosis and then from there to a treatment. There are other options when, for many reasons, we cannot perform these complementary investigation. We have to rely on a so-called symptomatic treatment. Means that we have to see the signs that the animal is giving us, and or the signs that we can read and interpret, and then plan a treatment that can fit better as possible with what we can see. But a lot of the time is like tossing a coin. A coin means that sometimes we can lucky and we guess the right treatment, sometimes not. Obviously, this way can bring with it a lot of pros and cons, because again, if we are lucky, yes, everything is going how we want. But if not, we can waste a lot of time. We can miss some of the signs, and also we can probably not make our patient feeling better. But why then we need them? Again, depending what we are looking for. Usually radiography, CT scan are more specific for our tissue. Say if we want to check for teeth problems, bones, or anything else, stones in the urinary ways. So anything is hard enough. MRI, I put there because obviously it's in the family of the family that's obviously can be included in the radiology, is anyway investigation that probably is possible, but in exotic still represents some limits, just related with the fact that he needs a lot of time to be obviously executed. So sometimes is not compatible with the size or the condition of the patient. And on the other side, we have the ultrasonography. Ultrasonography is literally more specific for soft tissue, because how an ultrasound works is by using high-frequency sound waves to create images of internal body structure. And means that obviously he needs soft tissue that usually contain water fluids. A device called transducer emits obviously these sound waves, and which travel through the body and bounce back, creating echoes. And the machine will be able to read these echoes. The times that it takes for these echoes to return, along with their intensity, is then used by the computer to generate a two-dimensional images and of the area that has been scanned. Is more or less what you can do when you are, for example, in a lake, or here in Scotland, on a beach or of a loch, and you are throwing a rock, a stone in the water. What you can obtain are a lot of concentric waves, and if there is something in the way, these waves will smash off against this object and then partially coming back. Means that more this foreign body, this object is closer to you, stronger will be these waves to come back. Farther it will be, then the intensity of these waves will be less. So more or less, to simplify a lot, but is more or less what it's doing when we are taking an ultrasound. And this is the machine. You can see there are more sophisticated machines, respect also a few years ago. And the images that we can obtain are very detailed. I remember that when I started 15 years ago, the resolution of the images weren't great, but was already much better than a few years earlier. But now we have a very clear images, and I will obviously show you some example later. Obviously, to take an ultrasound, as I said, we need the machine that usually are quite expensive. And then we need the ultrasonographer. In this case, it was me, but obviously in the hospital where I'm working currently, we have a dedicated imaging team that are obviously with the same machine, able obviously to scan any sort of animal. And then we need the patient. Sometimes the patient can be compliant, can be cooperative, sometimes not. So few times we can also rely on sedation. In this case was an armadillo that we had to scan the belly. And if you think what usually an armadillo is doing is literally closing like a ball, would be really impossible to take an ultrasound. So again, in this case, we had to sedate her. And on the picture on the top right, you can see this is a quite old picture. Especially you can understand this because you cannot see any white hair on me. So, but you can see how I was holding this rabbit. Nowadays, we are avoiding this position because could be put a rabbit upside down, obviously, or yeah, upside down, could be quite distressful. So what we are doing is try to keep the head a little bit upper. So to help the colleague to scan properly the abdomen or the organs that is looking for, but without stress too much the patient. And in the same way, we are also scanning, for example. But again, in any other cases, when the patient is not cooperative, we have to rely on sedation, like sometimes with ferrets and with armadillos, or any other animals that can be too small to be contained and restrained safely, or because they are too agitated, too nervous. So sedation, also if you can scare a little bit, but could be much safer for the patient itself. Or sometimes could be also marmoset. So the marmoset is a teeny tiny ape that, as you can see, is quite small. So in this case, there was also a risk for was handling because they can bite. They are quite sharpy. So there is also a sort of zoonotic risk, so a possible transmission of disease from the animal to us. And as you can see, here there are a couple of examples why we need ultrasound. For example, to check liver and kidneys, we can check liver to see if it looks homogeneous, there are any lumps, bumps. In rabbit, for example, we can use the ultrasound to detect if there is any liver lobe torsion. I don't know if, I hope so that no one of you had any experience with the rabbits with liver lobe torsion, but it's a quite severe condition. But most of the time with the ultrasound, if we arrive in time without wasting time, we are able to detect that there is a problem on the liver and possibly have a prompt intervent to fix the issue. We can check the kidneys. With the kidneys, you can see the liver is the bottom right. The other two pictures are the two kidneys. On the kidneys, we can see if there are any stones, if the anatomy of the kidneys looks normal, and all this information can tell us with the blood test or urinary test, see if the kidneys are working well or not. Then we can assess the reproductive system. In rabbits, as in guinea pigs, we can go and check if there are any problems at the level of the uterus. Like in this case, in this guinea pig, we were checking for the ovarian cyst. Guinea pigs are quite predisposed to this sort of problem. So say that at the 99.9%, they will develop this condition in their life. So could be, if there hasn't been spay, like a preventative intervention, could be any way helpful to check their abdomen, to check the cyst. Or in a rabbit, if the nurturing hasn't been provided in an early age and the uterus is still there, we have to check if there are any pathological condition. The worst case scenario could be a cancer, but we can have also other disease like pyometra when there is an infection, or hydrometra, or hemometra, so when there is fluid or blood inside. So, and the ultrasound is able to tell us show us what is going on inside. could be helpful, and this was for mammals. For example, in birds, we can also check for free fluid, so it's called coelomitis. So the coelomic cavity is the correspective of the abdomen in birds and reptiles. So coelomitis could be when we have fluids in the coelomic cavity. And for many other reasons, I already mentioned neoplasia, but we can also check in ferrets for adrenal glands and just check if they are the right size or if there are any other problems close to them. Ultrasound can also be used to diagnose a potential pregnancy. Sometimes we can rely just on the X-ray. You see on the left-hand side, that one was a guinea pig where we were checking if there were any babies. And you can see that there are 3 tiny heads, 1, 2, and 3. It sounds harmful, but just one X-ray is not so dangerous, especially for the babies. Obviously, we are taking just one and no more. But the X-ray, especially if the patient cannot be sedated, like in this case, or is too prone to be stressed, the X-ray could be a less or lower stressful procedure than the ultrasound to check, especially if we want to see how many babies there are still inside. Or like the armadillo that I showed at the beginning of the presentation, that was in to check if there were any babies inside. As I said, has been sedated, but in this case was more helpful to see with the ultrasound, because what I wanted to check was also kidneys, liver, and the uterus to see if there were any other concomitant and concurrent pathologies. And what we saw was this. I can start the video. See, this is the uterus, the oval rounded structure. And what is inside here probably were 2 fetus. But as you can see, you can really detect or understand what is going on. So what is coming in our help is the so-called color Doppler. So the color Doppler is a system that the machine has to literally give color to the what is going on inside, depending on the movement. And what we can obtain is something like this. See, here you can see there are a lot of artifacts, means that's something that we doesn't matter. But if you see in the center of the image, there is something that is pulsating, and this was the heart that was pulsating inside. And here there is another video, and you see the 2 fetus, and you can see clearly the 2 hearts that were beating. The rest of the blue-red area that is surrounding is just an artifact. Okay, so when we are taking the ultrasound, we have also to be quite obviously prepared and keen to read what is on the screen. Okay, and this means that every time we have a doubt on what is going on inside, an ultrasound, so literally use the probe and put the probe on and see what is going on, is very, very helpful. Going ahead and speaking about a little bit also reptiles and birds, just to don't obviously give the stage just on small mammals, but just speak also on the other species and other families. Egg-bound. Egg-bound is a problem that tortoise and reptiles owner and birds owner are facing quite often. And one of the way to detect these is the ultrasound, is the X-ray, and not the ultrasound. Why? But think how difficult it could be try to scan the shell of a tortoise. It's not very helpful, because also the shell is hard, is a hard tissue, so will be between the transducer and the soft tissue. Sometimes if the tortoise is big enough, we can try to have a transducer, the probe between in the femoral fossa, so the space where are the back legs. But again, what we can obtain is a partial image. And especially in tortoise, we want to know how many eggs are inside. So the ultrasound probably in this case is not the best. Could be helpful still to detect fluids, but not to properly assess how many eggs there are inside. Also in birds, sometimes the X-ray can give us more information than an ultrasound, especially if the egg is well formed. like also in this case, this one was a chicken. You say that the egg is very well, you can identify the egg very well. So for us, could be very easy to say, oh yeah, there is an egg inside. But sometimes when the shell is not perfectly calcified because there is, for example, a metabolic bone disease or a calcium deficiency, the shell won't be very clear on the X-ray and is what I call sometimes ghost eggs. Means that the eggs is there, but you cannot see them. So yeah, you can probably with a little bit of imagination, you can imagine that the egg is here. But in this case, the ultrasound is coming on our side to help us, because in this case, we can, with the probe, see if there is and confirm if there is an egg or not. So means that we can have also a so-called combo effect. So ultrasound and radiography, a lot of the time they can be complementary, means that sometimes the ultrasound could be enough, as, for example, radiography could be enough by itself, but sometimes they could be used also combined together. And the follicle stasis is one of the examples. I mentioned the tortoise earlier, but we can also scan obviously a snake, and a snake is quite easy to scan because, as you can see, also this one is a picture of many moons ago, but you can see with the ultrasonographer, with the probe, literally scan all along the body of the snake and see, plus checking liver, kidneys, and other organs, also see if there are any follicles or eggs. In the tortoise, again, we can find the same problem, because also if this one was a quite big tortoise, it was very difficult to try to scan with the ultrasound, and the only way was the sedation. The owner was not very keen to sedate his tortoise, so we decided, okay, why don't take a CT scan? Why the CT scan and not an X-ray? Because the X-ray, you need to figure out that the X-ray is a flat image. So it's giving us some information, but sometimes not enough. For detecting follicles inside, the CT scan is much more appropriate and much more accurate. I don't know if on your screen you can see on the picture of the top right, but there are some rounded structure. I try obviously to highlight them for you here, and this was the content of the tortoise. These are all several different follicles, with some that were very tiny, some are quite bigger. But you literally need to figure out that are like the yolk that is in a chicken egg without the shell. So the X-ray is not able to detect that there are there inside. So because they contain fluid. So for that reason, ultrasound potentially could be ideal. But again, because there is the shell in the tortoise, it would be very effective. And this is another example how ultrasound and radiography could be combined. Because if you see the X-ray here on the bottom left, you can see the eggs, but you cannot see the follicles. So it means that we decide anyway to go ahead with the spay and to remove the eggs and perform a surgery. And when we opened, we found also several follicles that weren't visible at the X-ray. And probably we weren't able anyway to see them, because see, this is the femoral fossa, this area here, means that the follicles were anyway covered by shielded by the eggs. So we weren't anyway able to see them. But at the end, we decide to, with the consent of the owner, to remove the eggs, but also spay the tortoise to avoid that this problem could relapse in the future. In lizard, like in this case in iguana, you can see that this is an image of an ultrasound. You can see this ovoid elongated structure is an egg, and you can recognize that is an egg because there is a white edge all around and a more rounded structure. So the elongated one was an egg, a soft egg, because again, it wasn't perfectly calcified, but was a soft egg. And this one was instead a follicle. But this is possible in iguana, or like a bearded dragon, as for example, also in a chameleon, because the skin is not thick like a shell of a tortoise. So we can anyway check them with an ultrasound. And this was the result. We also, in this case, we proceed with sorry for the picture if they're a little bit strong, but I mean, it's literally like if you have a chicken egg open on a dish. It's not very different than this. And you can see how the follicles, they could be also quite high numbers, and sometimes they can literally occupy a lot of space in the coelomic cavity. And we can have both eggs and follicles at the same time. Other situation that can see radiography and ultrasonography combined is, for example, in rabbits when they have sludge. Because see, with the X-ray on the top right, in this rabbit, we were able to see the content of the bladder that was very radiopaque, very white, because the sludge is like sand. So it's something that the X-ray can detect. But what the X-ray cannot detect is the bladder itself, so the wall of the bladder, and then is coming in the game of the ultrasound, because the ultrasound can, first of all, tell us more information, how the consistent, how thick is the content in the bladder, and also can tell us how thick is the bladder itself, because it's not a nice thing, but have bladder in the sand in the bladder is something that is rubbing the wall constantly, so it can be very painful, can inflame the bladder, and the bladder becoming inflamed become also thicker. So knowing how the bladder looks like could be helpful for us to advise you what could be the next step. Oh yes, it's just a little bit. See, in this video, you can see a very mild content in the bladder. So in this case, probably just changing the diet could be enough. So with a low calcium diet. Or if we see that the bladder is a little bit more thicker, we can also add on top of this also a painkiller or an anti-inflammatory, because again, could be very painful. Or anything else that can help the rabbit feeling better. The same thing, we can say the same thing for a guinea pig, but also guinea pig are quite predisposed to urinary problem, sludge, and to urolithiasis. So urolithiasis is when there are stones, okay? These stones can be located in different points of the urinary ways, could be at the level of the kidney itself, alongside the ureter, in the bladder, or the urethra. And each of these parts of the urinary ways can require a different intervention. Again, also in this case, radiography and ultrasonography can work together, because the X-ray can tell us exactly where the stones are. But again, remember that is a flat image, so we need at least 2 projections. So when the vet is advising you to take 2 X-rays, is at least 2. It's not because you want to, oh yes, I don't know what to do, and take as much X-rays as possible, or because it doesn't care of your rabbit. It's literally the opposite. Because if you have a flat image, you can see the problem, but you cannot locate it exactly where it is. So at least a multiple projection, so at least 2 projections, are essential to understand exactly where the stone is. Then, when we detect with the X-ray, if we want to go ahead with the surgery, could be anyway helpful to take an ultrasound too, because as I said, for the bladder, works also for the rest of the urinary ways, because we can see better the shape of the stone, we can see if the tissue around the stone is inflamed or not, and we can plan much better the surgical intervention, that is the next step, to remove them safely as possible. And I put this image a little bit bigger, that you can see. I know the quality of the image is not great, but this has been done with an old machine. But you can see this is the bladder, and these 1, 2, 3 were 3 tiny stones in a bladder. You can say, but here they look quite big, but they were 3-4 centimeters each in a rabbit that was 1.2 kilograms, so very teeny tiny rabbit. So compared, they were very big. As I said, X-ray is working much better with hard tissue. So if we want to check dental problems, between the most suitable investigation, the golden standard in this case is represented by the radiology. As we said, for hard tissue, bone, teeth, ultrasound should not work, because if you try to literally scan the teeth, you cannot see anything. It's like if you try to see towards a wall, so you cannot really see anything at all. So we have to rely on radiology to assess teeth, to evaluate, for example, any spikes, abscesses, malocclusion, bone abnormalities, if there is a fracture, osteomyelitis, so infection of the bone, neoplasia or cancer, and again, abscesses. So when you have an abscess on the jaw, sometimes you have also a reaction of the bone, all that is tend to surround the abscess. So means that the ultrasound also in this case is not working. We can also, with the more sophisticated one, also assess the integrity of the tympanic bulla. So if your rabbit has an otitis externa or media, we can try to have a glance and see what is going on inside, because the CT scan, for example, better than an X-ray, can tell us how the bones of the tympanic bulla looks like, and is also telling us if there is any material inside, or again, presence of masses that, like, again, anything that could be related or not with teeth. And here I put a few examples. And obviously, in this case, we were assessing the incisor. Okay. In the first image on the left-hand side, you can see the proper occlusion. So with the lower incisor that are perfectly fitting between the upper incisor and the back teeth. I see, as you can see here. Okay, so this is the right positioning of the lower between the upper and the back teeth. And remember that rabbit has 6 incisors, so 4 on the top and 2 on the bottom. And the back teeth, as I said, as I call them, spaghetti teeth, probably because I'm Italian, so I tend to relate with food and pasta particularly, but are very teeny tiny, but are essential to allow the rabbit to have a proper occlusion. Instead, on the right-hand side, there are a couple of examples of incisor malocclusion. As you can see, I mean, the difference is quite evident. And the upper right, with still the incisor in position, that you can see are very deformed, deviated, but are still there. And the picture below, instead, we have a completely different situation where the incisor have been extracted, but a post-complication occurred. You see here there is probably a tiny fragment of one of the incisor, and there is also the bone doesn't look white how it should be. It means that there is probably osteomyelitis. So what I said, that is the infection of the bone. Because, and sometimes could happen, not just because, not due to the skill of the vet, but also because the teeth can be, especially when the problem has been left there for quite a long time, could be much more difficult to try to extract the incisor. And, but obviously we on the skull, the ultrasound can be still quite helpful. I say obviously not to assess our tissue, but for the soft tissue, and which soft tissue we have on the head. So eyes and the content of the tympanic bulla. I say that obviously if you try to scan through the bone, you cannot really see anything, but you have to figure out that the tympanic bulla is quite thin. So sometimes with the ultrasound, we can obviously go and see through the very thin bone. Both, so the ultrasound obviously can represent sometimes, not all the times, but sometimes an alternative to the CT scan, but with several limitations. We can see obviously that there is a problem, but we are then not able to define it properly. So again, I can see that there is something in the tympanic bulla, but I'm not able to define you exactly what is going on. So, or in the eye or behind the eye, obviously could be the same. So, and go a little bit more in detail. So for example, taking an ultrasound of the eye, we can assess the content of the eye itself with extreme definition. better than taking a CT scan most of the time because the eye contains fluids. We can say that there is a mass behind the eye, a retrobulbar mass, because again there is fluid in the eye, so these allow me to go very in the deep, so even behind the eye. But we are struggling to identify it properly. So differentiate between an abscess and a neoplasia sometimes could be very, very difficult. Okay. What can affect our ability to do this is the size of the eye of the patient, okay, and the resolution and quality of the ultrasound images. That and it is the same for the tympanic bulla. So if we have a rabbit that is quite big, then would be still challenging, but again, with several limitations. An X-ray instead, again, can be combined and give us, again, information that can tell, oh yes, behind the eye, there is a retrobulbar mass that originated from a teeth. So means that if we are going through surgery, we have, yes, to remove the lump, the mass that is behind the eye, but we have also to extract the molar that caused the problem. Okay. So obviously, just before finishing, I would like to remember you that obviously there are many other webinars that we are planning to do in the next few months. Probably there will be a stop for the summer, and then we will start after the like September, October. But you can find all the previous webinars and this one on the YouTube channel. So they are free access, so you can obviously go there and review them without no problems. And the take-home message from today, which is obviously always consider a collateral investigation, means that if your vet needs any of these to tell you exactly what rabbit, tortoise, or parrot has, or also to confirm or exclude problems, collateral investigation are always helpful. I know that sometimes they could sounds expensive, but again, they are very, very helpful. And sometimes they can make the difference between sometimes life or death, because that can tell us a lot, but also can improve the quality of our animals a lot. There are pros and cons in all of them, okay? Because as we said, X-ray can be helpful for something, ultrasound can be helpful for something else, or sometimes they can be combined. I already mentioned obviously the cost and the information. Also, most of the time we can avoid wasting time, because if a guinea pig, just to mention one, is struggling to go to the toilet to urinate, obviously our suspect would be, oh, probably could be a urinary infection, or could be at the same time also a stone that is there and is causing pain. And the difference is between sending the guinea pig home just with an antibiotic and a painkiller and see what is going on, so tossing the coin, or try to see with the ultrasound if we can identify what is going on, if there is a stone, how the bladder looks like, and then plan a more appropriate and specific treatment for that guinea pig. That can involve also the surgery if the stone is quite big and required to be removed. And one of the downsides, sometimes sedation could be required, but again, don't be scared about this. I mean, if I have to sedate my dog, I have some concerns, but I know that could be in his best interest. My ferret, when I had to sedate him, I was scared, but again, I knew that was in his best interest, because especially when, for example, in a ferret, you have to take the blood from the vein on the neck, it'd be much more difficult and much more dangerous to do that without sedation. So if you have any doubt or any question, obviously, always ask to your vet about pros and cons and the risks that are involved. As usual, this is the QR code. If you can please dedicate just a couple of minutes to answer very quickly to the few questions that there are, that could be very helpful for me to understand if these evenings are interesting, there is anything else that I can do to improve them. If there is any topics that you want to speak, that you want to hear next time, that you want me to speak about. And yeah, if you have, obviously, thanks for your participation. And if you have